What is COVID-19? COVID-19 is an infectious disease that is believed to have zoonotic origins and has close genetic similarity to bat coronaviruses, suggesting it emerged from a bat-borne virus. Common symptoms of COVID-19 are aches and pains, sore throat, diarrhea, conjunctivitis, headache, and the less common symptoms are fever, dry cough, and tiredness.
Based on the survey conducted by Ipsos Southeast Asia Study, the survey was conducted prior to the end of the enhanced community quarantine in Metro Manila over the period of 22nd to 26th of May 2020 among 500 Filipinos.
Why coronavirus might impact your mental health? Stress. Fear of catching the virus and worrying about how you're going to pay the bills are just two of the stresses of the situation that can make it difficult to function. Disrupted routines. Many people are working from home while also having their children at home right now. No matter where you live, your routine has likely been disrupted in some way. Changes in appetite or weight. The stress can cause some people to eat too much. Others lose their appetites altogether. Reduced physical activity. Whether you normally walk a half mile to get on the train, or you have a job that involves a fair amount of physical labor, there's a good chance your current work situation may not require you to move as much as you usually do. Changes in mood. You might feel like you're in a bit of an emotional roller coaster right now. Lack of social contact. For most people, the coronavirus pandemic means a lot less social contact. Some are separated from family members and co-workers. Others live alone and aren't able to see anyone face to face.
The COVID-19 pandemic is stressful, and stress during an infectious disease outbreak can sometimes cause fear and worry about your own health and the health of your loved ones, your financial situation or job, or loss of support services you rely on. Changes in sleep or eating patterns, difficulty sleeping or concentrating, worsening of chronic health problems, and worsening of mental health conditions. And also, fear and anxiety about a new disease and what could happen. It can be overwhelming and cause strong emotions in adults and children. Public health actions such as social distancing can make people feel isolated and lonely and can increase stress and anxiety. However, these actions are necessary to reduce the spread of COVID-19.
A guide to mask use. Before putting on a mask, clean hands with alcohol-based rub or soap and water. Cover mouth and nose with mask and make sure that there are no gaps between your face and the mask. Replace a mask with a new one as soon as it is damp and do not reuse single-use masks. To remove the mask, remove it from behind and do not touch the front part of the mask. Discard immediately in a closed bin. Clean hands with alcohol-based hand rub or soap and water.
How can I protect myself against COVID-19? Number 1 is to wash your hands frequently. Second is to avoid touching your eyes, nose, and mouth. Third is to avoid crowded places and put space between yourself and others. Fourth one is to cough or sneeze into a bent elbow or a tissue. Fifth is to seek care early if you have fever, cough, or difficulty in breathing, so that if ever you have COVID-19, you can know as early as possible.
Ways to stay mentally and physically healthy during this pandemic. Number 1. Social distancing doesn't mean social isolation. Number 2. Exercise. Number 3. Eat a healthy diet. Number 4. Get enough sleep. Number 5. Consume the news in moderation